Good afternoon, Professor. My name is Alaida Isidoro with student ID number 1608-70234, and this is my wound dressing change video. Before that, this is the 360 degrees angle of the room. Assuming that the table is above my waist level, this is my pre-prepared materials, my wound care kit, saline, receptacle, garbage receptacle, tape, Q-tip, underpads, gloves, and measuring tape. Now I will introduce myself to my patient. Good afternoon. My name is Alaida. I'm the nurse in charge for you today. I am here because the doctor ordered to perform a change of dressing. Typically, I'll just remove the old one, assess your wound, and then clean it, then replace with the new dressing. Will that be okay?
Yes.
Thank you for your consent. Please tell me your complete name and your date of birth.
Charmaine Santos, January 31, 1993.
Okay, it's the same record with mine. I will now perform hand hygiene and provide you privacy. Now I'll prepare my wound care kit by opening it. Make sure that the flap is away from you, maintaining the 1-inch border. Can you please move slightly? Turn on the side and the other side, still maintaining the sterility by 1-inch border. And grab the forceps, the sterile forceps, then reposition the kit. Then segregate the 6 gauze, small gauzes. 4, 5, and 6. Then the 2 metal forceps, and then the 4x4 gauze. Then I'll put at side the sterile forceps, maintaining a 1-inch border. Then I will put the Q-tip on the pad. Same with the saline. We'll put a little saline in the container. And then next, I'll put the underpads just under the patient forearm to prevent soiling of the bed or the table. And now I will do hand washing and put on the first set of gloves. And before starting the wound assessment, I will now ask the patient if the level of comfort. Are you comfortable right now with your position? Okay. If you're in pain, can you rate your pain from 1 is the lowest and 10 is the highest? What is your pain score?
1.
Do you want to drink your pain medication right now? Okay. So, do you have any allergies that I should be aware of?
No.
Okay, none. So, I'll now proceed with the assessment. I will now remove the dressing. Make sure that you remove it gently. So as I can see, the dressing is mildly soaked with serous sanguinus and the dressing is still intact. And the location of the incision is in the right forearm, in the right anterior forearm. And if the suture used is staple, it is complete. And the edges is well approximated. There is no erythema and no swelling noted. I will now touch the surrounding area of the incision. Tell me if you're in pain.
No.
Okay. So upon the statement of the patient, there is no pain during the palpation. There is no swelling, no edematous noted. I will now measure the incision or the wound. Okay, sorry. I will put back the sterile forceps with 1-inch border, and we'll measure the wound. Okay, I will now compare it. So the length of the wound is approximately 9 centimeter. I will now discard the Q-tip as well as my gloves. Again, I'll perform hand hygiene and wear another set of gloves. Then I will now proceed in cleaning the wound by picking up the forceps, maintaining the 1-inch border, and we'll get the metal forceps and another one, maintaining 1-inch border again. Put it in this inside. Then I'll now start using a small gauze, and when you're cleaning it, we'll use the technique like clean it from the least contaminated to the most contaminated, and from head to toe. Then the method will be the dumpling method, and then roll it when you're cleaning it. And then in the wet saline, clean it from the farthest away from me. Okay, next. Clean it closest from me. Next. And in the midline. Then after cleaning, pat it dry using the same technique and method. Again, farthest away from me. Tap, 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 tap. Next. Closest from me. Tap, 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 tap. Then in the midline. Tap, 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 tap. And once you're done, put on the 4x4 gauze and make sure to cover the wound to prevent from infection. And put on the forceps beside, and then tape it in all 4 sides. And then using the small or the 1/2-inch tape, you will put the date and time, document the date and time that you perform the wound dressing, and then make sure that the patient is comfortable. Are you comfortable right now? Do you feel any pain? And make sure that, assuming the patient is lying in bed, make it in the lowest position. The bed is in the lowest position, and the cobble is within the reach of the patient. And now this is the end of my wound dressing. I'll now remove the gloves, and after that, document all the gathered and observe care or assessment, and observe all the document all the needed data. And now this is the end of my video. Thank you, and this is the 360-degree view of the room. Okay, thank you, Professor.